For those guys who are with us already, I'm delighted to welcome Dr. Helen Spence this evening to deliver her talk, which is entitled Kissing Spines, the Behavioural Viewpoint. Now, Helen qualified from Queens with BSc Honours in Psychology, and then also finished a doctorate after that as well, and then opened her consultancy business in 2003. It's hard to believe that long ago.
No, it's a bit scary.
So Helen then has been just doing sort of equine behaviour advice and training on a one-to-one basis then from 2003. And I actually, she's taught pretty much the looks of it all around the world, as far as I could see, and still teaches the vet nurse students at UCD. And is particularly passionate about giving foals and yearlings a really good start in their handling and their training to try and prevent sort of behavioural issues later on in life, and is also really passionate about trying to improve horse welfare by improving our knowledge as owners, to try and make our horses training a more positive experience for them. And finally, Helen has also developed her own range of online courses. So if anybody is interested in those, I'm sure you can speak to Helen later, or I'll put the details up on the group, Helen, anyway. So,
and I've actually, you'll be pleased to hear, I set up a wee discount code for everybody that's doing this tonight, that I'll give you, just in case, not that I'm expecting anyone to do any of the things, but if I thought that reading the horse course might be of interest, the body language, because it's all about expressions of pain and stress and stuff, so it's quite relevant. Anyway,
if you give me any of that info, and I'll put it up on the group, because funny, the nutrition girl, definitely from the last webinar, there was definitely interest for her afterwards. So I mean, obviously everybody gives up their time for free, so it is nice for some people to get a bit back anyway.
Yeah, thank you, that's great.
I am going to
Okay.
John already done that, or
let me see. No, it's not enabled yet. Not enabled even.
Yeah, I'll do that now. And I'll mute myself.
No, it still says host disabled, participant screen sharing.
Change the host to Helen. Yes, I do.
Oh, here we go. Right. That's it. Okay. So I will just pick the right thing to share. There we are. And slideshow. Now, just to make sure I've shared the correct thing, can you see just the presentation and not all the other stuff? Yeah, cool, brilliant, that's great. Okay, so that's us ready to go, basically. So the only thing I have to check, because I haven't done that yet, is because my laptop's sitting up here and I have got my keyboard in my lap, so I just want to check that actually I can change the slides with my keyboard, that that's actually working. Yep, it is. Cool. Okay, so we should be all ready to go. So this is a kind of a gallop through tonight, because actually and what I've done is I have taken a bit of a case study and I've like condensed it down to about probably a quarter of what, maybe not even a quarter of what it would normally be, but I thought it'd be interesting for you guys. And I've just kind of tried to think of it like a signposting exercise, I guess, for things to look out for, and the stuff that I think we all need to be aware of. Now, I'm very fortunate because of my own personal horses. I haven't yet, touch wood, had issue with kissing spines, but I have had issues with lameness and arthritis and pain, and I have dealt with clients' horses that have had a kissing spines diagnosis. So I think for me, the key thing is the importance of the team. And I think what I love, Lisa, about what you're doing with this is just bringing in all the aspects of the team, because it all relates. You can't just take one thing in isolation. You kind of have to have the whole picture. And the better we all get at communicating with each other and recognizing each other's expertise, the more success we have for the horses. And, you know, I just love this. I think that this is the way we should all be working all the time. I know when I started my business, I had this rather naive idea that everybody would be friends and everything would be great. And it doesn't always work out like that. But definitely in the clients, with the cases where we do have that kind of team approach, it is always beneficial, definitely. So I'm a big fan of that. So thank you, Lisa, for kind of giving this opportunity, I guess, for us all to talk and discuss and hopefully make things, help people become more aware of the different elements. So my role, I guess, so, you know, I am primarily a behaviourist. I do a lot of training, just simply because that's a big part of behaviour work. And I do a bit of coaching because I'm coaching my clients all the time. And I do try to have an awareness of kind of all those areas. But something that we do always need to be aware of whenever we're talking with people is just how much practical experience do they have? What is their theoretical knowledge? What are their qualifications? How many miles do they have on the clock? Because it does always help if they've got the actual kind of background where they've seen a lot of different horses and have a good awareness of you know, not just book learning, I guess. Sorry, I just want to move my sorry, I want to slide. Oh, there it is. I want to slide. You see, you can't see this. This is on my screen. I'm trying to basically move the Zoom bar down because it's a bit annoying. It's a bit in my way. Anyway, that looks better now. You see, you guys can't see it because it's not on your screen. It's just on mine. But I realized that I wasn't actually going to be able to read my PowerPoints because the bottom points were going to disappear. Anyway, so, and now because I've done that, now it doesn't want to change screen. Come on. But you love technology. There we are. Teamwork makes the dream work. That was really the last point there. And just what I've been saying about this idea of it's so important to have that mutual respect for every player in the team and the recognition and support of the roles that we all play. So very quickly, this is something that I think we're not really aware of here in Northern Ireland. Like, I mean, I have been doing this job for 20 years, and at the start, more than 20 years, and at the start, people used to just say, "What are you doing?" And they couldn't really understand what the job was, let alone, you know, how I could possibly make a living out of it. But now we have got, so there's not a legal requirement for registration, but we have a voluntary register, and that currently is the Animal Behaviour and Training Council. So we've got a range of different levels on it. Top level there is the veterinary behaviourist. You have to be a vet to do that. And the next level down is clinical animal behaviourist, which is what I am. So I'm very pleased to have achieved that. It took quite a lot of work. But it's just to kind of draw attention, I guess. And as far as I know, I'm the only equine specialist ABTC registered clinical animal behaviourist in Ireland, I think. There are others that would be for small animals, but not for horses, as far as I know. So anyway, just to start off with then, what is behaviour? So basically, behaviour itself, the definition is that it's just a response to a situation or to a stimulus. But I like to classify it as information. It's information that tells us about what is going on inside the horse. So behaviour is what the horse is doing, and that tells us how they're feeling. And how they're feeling matters because then we can use that information to recognise, you know, do we need to change things about the environment? Do we have to change things about how we're training? Do we have to change things about how we're managing them? Or actually, is there pain in there? So it becomes communication then. You know, it's a way that they can communicate to us what is going on. And we then, by our actions, can communicate back to them that we understand. And I know that might sound a bit kind of airy-fairy, but actually it's very real. If, for example, you're riding your horse down the road and they stop and the head comes up, we recognise that information as increased arousal levels. Something has startled the horse. They're wanting to take a little moment to take the information in the stimulus that they've spotted. And if we recognize that and we observe the environment and we can recognize what the trigger is, we can then take steps to help the horse feel better. So perhaps we need to actually put a bit of distance between ourselves and whatever it is. Perhaps we need to reassure the horse in some way. And by doing that, we communicate to them that we recognize how they're feeling. And over a period of time, what actually happens is you have a horse that starts to trust you a little bit more, and actually becomes increasingly relaxed and less tense in situations, because the way you have responded has kind of supported them through what's going on. So I do think that's really important. So we just want to basically think of it as something. So whenever we talk about problem behavior, it's not something to get rid of. It's a sign. It's a sign of what's going on. It's something that we respond to. It's something that helps us to identify what the underlying issue is. So then we talk about training, and what is a training issue? So the thing about training problems, they're generally really easily sorted out. So if something has gone wrong and it's just because the horse hasn't understood what you're asking, or you've accidentally reinforced the wrong thing, then you can really quickly sort that out. They don't tend to be big emotional issues. There's very little stress. There's no real trauma, and you don't have any related medical issues. And that's really important. All you need to do then is just make simple changes to your training or the kind of program that you're using for your training. So for example, if you have a young foal who has been taught to lead, hasn't been taught to lead, or a young horse who's never been on a trailer and won't walk up the ramp, or perhaps a horse that walks out the stable door every time it's open. You know, these are all the kinds of issues that we see. Or perhaps they walk off when the rider gathers up the reins to mount. Quite often that's just because nobody's ever actually trained them not to do that. So that's a training issue, and they're very easy to sort out. But then if we start, oh, sorry, forgot to turn my phone to silent. Anyway, I'll just do that quickly now so that it doesn't ring again. Right, that's that sorted out. So what is a behavior problem? So behavior problems can be very resistant to retraining. So that's the difference quite often between them and training problems, and they can take time to address. They generally involve a degree of trauma or fear. They may be related to medical issues such as pain or illness. Oh, I must have set this up to keep going and I'm not catching up with it. Anyway, they can range from, you know, very mild to quite serious. And the problem is that quite often they can get overlooked and treated as training issues. But the problem is then that they don't respond. Or what happens, I'm not quite sure what's going on with my my slideshow, but it's getting very carried away without me. Anyway, what can happen then is that the underlying issues don't get addressed. So people look at the behavior as a training problem and they attempt to train it away. And actually, because the underlying issue is still there, then that doesn't actually get addressed. And so the problem kind of perpetuates. It just comes out in a different way. It's a bit like if you had a hose and the water pressure was too high and it kept bursting out through the hose, you know, jamming up, covering over the burst is just going to mean it's going to burst out somewhere else. It's not actually addressing the underlying issue, which is that you need to turn the tap down. Okay. So when is it that we need to refer to a clinical equine behaviourist? So when the behaviour problem's new and it isn't responding to changes of, you know, like management changes or retraining. Whenever it's something that's a safety issue, so that's really important. When it follows a traumatic experience, so something that's been, you know, like an accident or a fright that's been quite traumatizing for the horse, or if it's rapidly worsening, or if you see significant changes in quite a number of aspects of the horse's behaviour. If it's been there for a long period of time and it's not improving or is actually worsening, if there has been some kind of an accident or a physical issue, illness, disease, whatever, that has been treated, but the problem behaviour persists, and when any other attempt to address the problem with other professionals has been unsuccessful. Now, I will be honest, when I started my business, I, for many, many years, felt like I was always the last resort. So people came to me with the problems that were so bad because they'd been through everybody else and nothing had worked. You know, that's a good, I guess, because at least I could help them when they got to me. But it was very frustrating as well, because if they'd come to me first, the problems wouldn't have been so established, and we would have been better able to address them. I have no idea what I did when I was saving this slideshow. They do not normally do this, but this one just keeps running on itself. Anyway, so that's just like a kind of gallop through what my role is and when I can help. But you're really wanting to know what's relevant. How's this got relation to kissing spines or other kind of pain-related issues? So very quickly, on a very simple level, our motivations for behaviour are motivation to move towards something, achieve something that you want. So that can be food, company of other horses, physical contact, or it can be movement away from or the attempt to escape something that you don't like. So that's something that they either want to get away from or avoid completely. So that can be pain. It can be the threat of pain. It can be a sudden surprise. It can be something that's new and unknown. So those are kind of, that's a very, very, very simple way of describing how behaviour is motivated as either towards or away from, but it's kind of the easiest way to think about it. And then the other thing we need to do is we need to think about identifying stressors and what stressors are for horses. So stress is any type of change that causes physical or emotional or psychological strain, basically. And when we've got acute stress, what we get is the nervous system kind of ramps up, gets active, and we also have activation of the HPA axis. So that's to do with the hormones involved. And the thing that triggers that response is the stressor. It's the stimulus that causes that response. Sometimes that can actually be a positive thing. So whenever we have positive activation of the nervous system, we can actually have enhanced performance or problem solving, but it can also be negative, okay? And what we need to do whenever we are looking at behaviour issues is we always look at the horse's day-to-day routine and their management, and we look for any potential negative stressors that are present that could be causing that negative stress response. And if we have lots of stressors, so if they're frequent or repeated, then we can end up with a situation where we have chronic stress, and that does have health implications for the horse. So we can have anxiety, insomnia, muscle pain, high blood pressure, and a weakened immune system. So it's good always to be looking at what I call life stress and how we can reduce that for the horse. And the other thing that we need to be aware of is that when we have stressors stacked up in a close kind of period of time, then their impact is much, much higher. So we end up with a much bigger reaction from the horse, a much bigger stress response. And that is a safety issue. It's also a welfare issue for the horse. So the reason we're talking about all this is because pain is a big part of this, okay? Pain is a stressor. And I have this photo here because this is a horse showing classic pain face. So you can see her lips are very pursed, kind of tight. You can see lines on the side of her face there, kind of wrinkles up the side of her face, wrinkles below her nostrils. There's a lot of tension through the jaw muscle. And overall, we've got a really quite unhappy horse. So stress and pain cause the same response in the nervous system. Basically, stress hurts and pain is a stressor. But we, with our horses, if we can identify sources of stress, and it's just something simple like the horse doesn't get on well with the horse that they're turned out with, or the training method's not appropriate, or they're not getting turned out enough. That's very easy actually to address and to reduce that stress. But when it's pain, it's a lot harder. And the thing is, It very much depends on the nature of the pain, the impact that it has. So depending where the horse hurts, that pain might be very predictable. It might happen every time they do a particular thing, in which case they will avoid that particular thing. Or it might be unpredictable. They might not know when it's going to come, and this has an impact on the behaviour. So if you see a horse consistently avoiding doing something, let's say it's right canter transitions, or jumping off the right rein, then that is telling you that there is probably an underlying pain issue that is predictable, that happens when they do those things, and that they are trying to avoid that. But if the behaviour is erratic, if the pain is erratic, they can't predict when it's going to happen. And the stress levels can get really high in that kind of situation because they don't know when it's going to come next. And so you will see a difference in the horse depending what kind of underlying issue you have going on. And the other thing is that through learning, so classical conditioning is all about, it's a reflexive form of learning. It doesn't happen at the conscious level. We don't have to, it's not like trying to remember a series of numbers, you learn. This happens with us, it happens with horses, and it's to do with reflexes, and our emotional response, our nervous system response is a reflex. And so if you have a response to pain, and that can then become classically conditioned, learned to be associated with quite a wide range of triggers that really shouldn't mean anything. So even something as simple as the approach of a person becomes associated with the pain. Perhaps say a person carrying a saddle may be associated with the pain that happens during riding, for example. And we'll see that particularly with the kissing spines horse. We may initially have a horse that is a little bit reactive during grooming and doesn't stand to be mounted. And then they might start to become a little bit reluctant to stand for the saddle to go on. And then they might turn their back whenever the saddle's set on the stable door. And then as time goes by, they might start to get a bit difficult to catch. And then they may start to actually become quite reactive and defensive, maybe kicking out, or, so you can see how behaviour problems can develop. The horse is simply communicating how they are feeling about those triggers that have become associated with the pain. But actually, we haven't responded to those things. We haven't paid attention to the information that the horse is giving us, and we've carried on doing them. So the horse then has to go from quite quiet responses to really big responses, and they tend to get quite dangerous. So it is a safety issue, quite as well as being a welfare issue. Now, the other side of that is if you have chronic pain, so if the pain is there all the time, it is inescapable. Okay, so when you have an inescapable aversive stimulus, and this can be, a thing in the environment that's causing stress emotionally, or it can be pain that's within the body. What happens when you cannot escape that stimulus? The nervous system can't stay on high alert the whole time. It just can't do it. So what the body has a way of coping with that, and that is shutting down and becoming depressed. And so I do see this. I see horses that will, maybe as the bridle goes on or the bridle's brought out, and I've seen this with quite a few horses over the years, not all with kissing spines, but all of them with physical issues, they will start to blink their eyes and appear to go to sleep. And the owners have all thought that those horses are being sleepy horses, when in actual fact, the horse is shutting down in that situation because it's become so strongly associated with the pain that they experience in that situation. Now, if that pain is there all day, every day, and all night, every night, that horse will actually become quite depressed in general. So it's something to watch out for. And learning to recognize that, I think, is one of the most significant things that we can do as horse people, because it's actually very easily overlooked. People tend to notice when a horse is misbehaving, but they don't notice so much whenever the horse is just shutting down. The other thing is then, when you have the nervous system reacting to the pain, you can sensitize the nervous system. You end up with a hypervigilant horse that's actually very reactive, hyperreactive. So those are just different ways that pain can impact on behavior. And it's just so important that we pay attention to what our horses are telling us, because that's what keeps us kind of tuned into the horse. So this is the course that I was just saying about at the start. I set this up and it's just called Reading the Horse, and it's basically just taking you through all the behavioural signs, the posture, the body language, the facial expression that horses will use to indicate to us how they're feeling, what is going on in their nervous system. And so I've set up a discount code for everybody in Lisa's group. And it's just KS Talk, KSTALK. But it's only available to the end of May. But I'll give Lisa the details and she can share them with you all anyway. So very quickly, we'll go through a case study just to kind of illustrate these points. So this mare was 10 years old, 16 hands, breeding unknown. She was pretty blood looking, possibly a trotter thoroughbred cross. She had been purchased in the February and had a 5-stage vetting, but she wasn't ridden at the vetting. There apparently wasn't a rider available at the time. So she just had the kind of traditional vetting process. She was then seen by an ACPAT chartered category A physio, who found her to be very stiff on her initial assessment, but she did treat well and was moving well after her treatment. And there were no other known issues at this point in time. So she presented with, she was tense to mount. She was spooky when she was ridden during the first few weeks after purchase. I can't read because this stupid thing's in the way again. I think I've written cantered off there in the forest and in the school. And this culminated in her actually bolting in the school, spooking at something and then bucking, and the owner fell off and was injured. So following that, she was sent to a friend's yard to be kept fit while the owner recovered from her accident. And during that time, she lost a lot of weight. She was stabled. The friend felt she was quite uncoordinated and difficult to ride on hacks, and she was struggling on hills. So she was treated by the physio. She was seen by the vet. They were querying ulcers. The vet recommended that she would be returned home and turned out 24/7 in a herd, and to see how she responded to that, because they felt that it was the stabling and perhaps the riding that was the issue in that yard that she was at. So she returned home, she gained weight, she appeared more relaxed. The physio was very pleased with her on her second visit. The vet was happy, the weight gain was sufficient, and so they decided not to do any further investigation. No obvious signs of pain or pain face at this point in time. And by the May, the owner wasn't ready to start riding, but was ready to start doing some groundwork. And this was the point that she booked me to come out and see her. So she said she was very sweet, friendly, curious mare, very easy to catch, but she said she would get quite upset about leaving the herd. She would call a lot and walk around the stable in an agitated manner. Now, for me, separation issues are something that I see an awful lot. You know, most of our horses are unfortunately abruptly weaned too early, and so we tend to get exacerbated separation distress issues in a lot of horses. But what I have found over the last 20 years is that one of the big things that exacerbates separation distress is an underlying physical pain or health issue. And in all the cases where I have seen it worsen, they have all been related to an underlying physical problem. So the other thing about this mare was she would rush when she was leading, and she would swing around if she was asked to steady or slow down. Leading downhill was very difficult, and she did say that when she looked back at how she was ridden at the start, she could see that she was rushed, she lacked focus, she was always looking to see where the other horses were, although at the time the owner did feel she was comfortable enough in walk and a little trot. Also, she was fairly easily spooked. So you could say all of this sounded like you know, sort of straightforward behavioural issues. She obviously had separation issues, and perhaps that was what was underlying everything. But also she didn't stand to be mounted. Now, again, you can get that if you have got a horse that's stressed anyway. You know, there are lots of different potential causes for that problem. When I went to see her, she was very relaxed around people. She was quite curious, quite friendly, good touch acceptance. She was relaxed when the other horses were around. I did note that she chewed the wood on the stable door a little bit. And whenever she was leading, she was certainly very quick to follow when moving off, but she was hard to stop. She was easy to tack up. She was good to lunge. But there was a big difference in her behaviour in the yard compared to the arena. So she was particularly tense at the far end of the arena, which was furthest away from the stables and furthest away from the other horses. She was calm to lead in the field if the other horses were around, but she did struggle with her balance on the hill. She'd also developed some skin issues. So as a behaviourist, what I'm always doing, I'm reviewing what the symptoms are. We look at the case history, do a practical assessment of the horse. The vet examination should exclude any potential pathophysiology. So we're always working on the assumption that any underlying physical issues have been addressed. But of course, that's not always possible. You know, vets have a limited kind of number of diagnostic tools that they can use, and not every condition is easily diagnosed. Not every condition is necessarily immediately apparent. You know, so my job, it's not my job to be a vet. I'm not a vet. But it is my job, if I see a behaviour that is not responding to the behaviour modification that I would be doing, that immediately gets flagged up to me that there's still another issue potentially underlying. We need to get back to the vet and say that there's something else going on here. Not because I can see any physical issue, but because the horse's behaviour is telling me that there is something that is bothering them. And so I always say it's a bit like being Sherlock Holmes. We're trying to identify the underlying issues and kind of go through a process of elimination sometimes. So with this horse, so she was running away. There was a failure to respond to the aids. She was spooky. She was bucking, although actually the owner said the bucks weren't that big. We know that running away is an escape response. We know that spooking is also an escape response. Something has startled them. And we know that bucking is a fight or escape response. So these are all indicative of some kind of aversive stimulus that is creating stress. Now, there could be training issues there. There was a failure to respond to the aids. So perhaps there was inadequate training, or perhaps the rider was applying the aids incorrectly. Or perhaps whatever other aversive stimulus was going on was more significant, and the horse was paying more attention to that than they were to the aids. Also, she had come out of, although she wasn't a race horse, she'd been kept in a racing yard. So perhaps she'd been trained to run into a contact. Spookiness is normally a reactivity to external stimuli. How normal or abnormal is it? Depends really on the horse, but actually they shouldn't be that spooky. And if they are, it's because there's something out of balance. Okay, there's something, either too many stressors in their day-to-day life, or too many stressors in that point in time, some kind of stress relating to their management, or another underlying undiagnosed issue. So this horse we knew had elevated stress levels. She was in a strange environment. She just moved home. She definitely had separation related to stress. She did have learned negative associations with riding in the arena, and perhaps some stress related to stabling. So there were stressors there that would predispose her to having a reaction with the rider. There probably were some stimuli associated with pain or discomfort. Potentially riding in the arena was not something that she was used to doing. The saddle hadn't been fitted, so there could have been physical discomfort from that. She was being ridden in a different bit. Perhaps there was physical discomfort from that. It hadn't been correctly fitted either. Less experienced rider, maybe less fit rider with some shifting balance or weight, maybe unfamiliar or unknown aids, which can be stressful. She'd been separated from the herd. There also were a few things that happened at the time of the fall. So the light was reflecting on the house window beside the arena. The cat came walking across. There was a sunken lane beside the arena that might have all kinds of things hiding in it. So there were lots of potential factors there. She also maybe didn't have great physical balance, didn't have a great way of going. But that's also another kind of red flag. Why did she not? And of course, we even whenever we've been told, well, there doesn't seem to be much wrong with this horse physically, I never really completely rule out pain in my head, because, you know, we do have to keep having, and this is why it's so important to kind of have the conversation, because whenever I see a horse not responding, the first thing I always want to do is say, back to the vet. So what could we do with this horse? We could reduce her life stress. We could get her saddle fit and her teeth checked. We could start some in-hand work, using food rewards, find a way of making the experience more positive for her, building up the relationship with the owner potentially. We don't always use food, but in this situation, it was appropriate. We could work on separation. We could build up her confidence leaving the herd. We could start riding with a different rider initially, because the owner was still recovering from her injury and her daughter was more experienced, so she was able to start riding. And we could look at just some simple basic reschooling. So transferring in-hand exercises over the saddle, working on walk halt transitions and building up, making sure that she understood the aids, that she was really clear about what was expected. And then using this as a way of changing the associations with the arena and with the rider. And this is why we were using food, because we wanted to build up positive associations. And I always think having a really good downward transition in there that's been heavily reinforced with something very positive is very valuable in situations like this. And the rider then, the owner was going to work on riding on the other pony that they had to build up her physical fitness and her strength, and then start to ride this mare. So again, you know, in theory, everything was in place behaviourally to start and change things for this horse. So she did respond quite well. She only rode when the other horses were stabled, so that they weren't kind of moving about too much and they were nearby. Definitely increased in relaxation. The in-hand work went well. She was able to build up to going for hand walks in the forest. She did still show some tension in the arena though, despite this calm riding routine from the owner's daughter and regular use of food for downward transitions. She still remained quite tense in the canter. So I'm immediately thinking, hang on a second, this horse is not responding the way I would expect to this retraining, this behaviour modification. But she did have a much improved relationship with the owner, who wasn't actually riding her at this point. We got to mid-August and I really wasn't happy, because what I felt was that she was, when she was under saddle, she was becoming stressed. And then when her posture would change, she would then seem to become increasingly tense and anxious. So if anything happened to make her spook and she came into a higher head carriage, then the spook, the tension would magnify and the reactivity would be well out of proportion to whatever it was that had actually triggered the initial change. So it was like she would be startled by something or made tense by something, and then all of a sudden it would just get way bigger. And that's not normal either. So, and the owner also noticed she thought she was a bit tender to groom, and she looked unhappy when she touched her on the saddle area. So we said, back to the vet. So, you know, obviously the vet was happy for us to look at her initially and do the behaviour work. But the second I saw that she wasn't responding, I said, no, you've got to go back and look into this. So the vet watched her riding, assessed her movement, palpated her back, suspected there could be kissing spines and recommended x-rays. And sure enough, the kissing spine diagnosis was confirmed and she had surgery. So next from that then, so you can see, so it was the behaviour that led to the diagnosis. It was the behaviour change. And she was ready then to start into her rehab work. Now, the key thing I think here is she came back with a programme from the surgeon, which was lovely. And I'm not saying that my expertise is physical rehabilitation. It's not. I'm a behaviourist. My expertise is reading how the horse is coping with the behaviour or the physical rehabilitation. And when I saw the programme that had been sent back, I thought, for goodness sake, it was for a horse that had been in work right up to their surgery and was already very fit, probably, you know, geared up for race horses and the like. And this mare wasn't. She was nowhere near that level of fitness. And so there's no way she was going to be able to work through the programme at the speed that was delivered. Now, she had a good physical kind of team around her, a vet and physiotherapist and all the rest, who were then able to advise a more suitable rehab programme for her. But what I said then was that I felt that it was important that we keep a really close eye on how she was coping with the programme. So she started walking out in hand. She wanted her stretching, so we actually did some target training, looking at walking in a stretch position, doing back up, teaching a square halt, and started doing this in the arena. And there were times that was challenging because there were still emotional issues attached to what went on in the arena, because that had obviously been something that actually had been painful for her for quite a long period of time. And we started to get some progress, but it was slow. And then she was able to start some gentle long reining with, again, the focus on positive reinforcement for the halts. And she started to really improve at this point. Going out for walks in the forest again, tension in the arena reduced. And I guess as she built strength, she became more and more comfortable. So the behaviour change told us that she was coping. The behaviour change told us that she was getting stronger, that she was more comfortable. And it used to be during sessions, you could see when she would start to get uncomfortable, she would start to head toss. And you could see she would do that more on the, which rein was it, left rein or the right rein? Whichever one I said she wasn't so good on. So get a little head toss, tail would start to swish. You know, there were indicators that she was starting to become uncomfortable. And so as long as the owner managed and didn't push too much, she continued to progress. She was introduced to the equibands, and again, worked through a very gradual program with that. And not only did her behavior change and she became much more relaxed, but she started to gain weight as well. She then went back to living out 24/7. And then the long reining progressed to working in the field on the hill. And so by this stage, she was way happier, much, much better, and finally looking strong enough to ride. So the thing, rather than go any further detail with her, it's just to kind of show you the picture of where the behaviour comes into that kissing spines diagnosis. Sometimes it's the behaviour that takes us to it. Sometimes the behaviour helps us come out the other side of it. But what you need to remember is that pain's an aversive stimulus. It causes escape responses. And then with learning, those become avoidance responses. So you get a horse that is avoidant of particular situations and particular triggers. Because of that classical conditioning, we can get really strong associations between that negative emotional state that's caused by the pain and the various bits of equipment and the experiences that are involved. Treating the pain doesn't always treat the behaviour, especially if it's been intermittent or only in particular situations. If the pain's there all the time and then the pain goes, the horse knows the pain's gone. If the pain only appeared in particular situations, the horse doesn't know until they're in those situations if it's going to happen or not. And of course, we have a horse that has already learned to avoid. So they're not going to take the chance of experiencing that pain, especially if behaviourally they have learned responses that have been successful at avoiding that. So that's why treating the pain doesn't always get rid of the problem behaviour. So we need to work then to change those strong negative associations into positive ones. And that's my job. And that can take time and a lot of repetitions. So key points. Recognize the signs of fatigue or discomfort. So it's all about how the horse perceives the pain. So it's not about how much pain they ought to be in. It's not about how bad the x-rays are. It's about how does that particular horse feel about that particular situation. Just like people, some horses are a lot more stoic than others. Some horses have a much higher pain threshold than others. Every horse has a different coping response, and their life experiences mean that some of them will shut down, some of them become more reactive. The pace of rehabilitation should be led by the horse. But in order for that to happen, you've got to be able to read what the horse is telling you. This particular case was exceptionally slow, but it was very worthwhile. And the important thing, I think, was that we made use of appetitive stimuli, so food reinforcers, a nice scratch, so that we could change those negative associations that she'd built up. But most importantly, it was about the teamwork with the rehab team. So me and the behaviour end of it, the vet, the physio, the farrier, you know, everybody that was involved. And of course, the owner, who worked super hard. Not, you know, she really did everything she was told. She was brilliant. And that's it. So as I say, it is a bit of a kind of a gallop through, but we don't have a huge amount of time. So it's just to kind of get you thinking, really. And then if anyone has any questions at this point, I'm very happy to answer them. Maybe if I stop sharing, that might be easiest. So, any questions? Feel free to just unmute yourselves and ask, or stick up a hand, or we can't see because most of you got your cameras off. But
I'm actually very curious now about separation anxiety.
yeah, have you got that increasing, or?
No, it's not increasing. She's just absolutely dreadful.
Okay.
I have to just manage. Like, for example, I went to Drumkeir Forest this morning, but my easiest option was car packed, bring car with trailer to field, lead her straight onto the trailer and go.
Yes.
And then sort her out whenever I got to Drumkeir, because I mean, you can't brush her, you can't do anything, because she just goes mad.
Yeah.
So I'm now going, oh, is this an issue? Thing is, she came out of Germany as a foal.
Yes.
So
She probably early weaned, probably quite abruptly, I would imagine. Yeah. You don't know what age?
No, I don't know. I just know Jane and William got her out of Germany as a foal, as a companion for another foal. But no, funny, to manage her from the ground is really quite difficult. Like, even if you take one horse out of the stable block,
Yeah.
she can't cope.
Yeah, and you know, it's one of those things, I think. So there are certain things that really have to happen when they're young that naturally would happen. So one is that they grow up in a herd. And in the herd environment, what happens is they start, so the first few weeks, obviously they stick close to mum, but then they gradually start playing with their friends. And it's a safe environment, because if something happens that spooks them or worries them, they all zoom back. Like, I love watching foals. I just, it's my favorite thing to do. But I've seen this so many times. Something startles them. You know, they're all playing over here. Mums are over there grazing, and they all zoom back to each mum, and they'll have a quick suck, and then they kind of go, whew, I'm okay. I've done that. That's all right. And then they go back to playing again. And gradually, as they get older, they don't have to do that for as much. It takes a bigger, scarier thing to cause that. And then as they get older again, they might go back to mum but not suckle, just kind of touch her or check she's there. And then they start checking in with their friends instead. And so through that kind of first year of development, they develop the ability to self-settle or self-soothe. And it's just a natural progression. But we stop them doing it. And not only that, but actually, if she came out of Germany, it's very, very possible that she didn't actually really have great socialization with other horses either. So she not only missed out on that bit, but she also probably missed out on her ability to learn her emotional control, because that they learn, in my opinion, they learn an awful lot of that through play. So play is only play whenever each individual manages themselves. If somebody pushes too hard or gets too carried away, it stops being play, because the other one goes, "Ooh, I don't like that, don't do that." And that's disappointing. So the next time that individual goes, "Oh, I mustn't push too hard with you because you don't like that." And through playing with lots of different individuals, they learn how to manage themselves really well. So a well-socialized horse has got good emotional control, and one that gets to wean as an older horse, so 10 months plus, also learns that self-settling. And do you know, I mean, honestly, see the separation thing. If I had a pound for every horse that I saw that had separation issues because of weaning and their early management, I would be a millionaire by now. You know, they're everywhere. I'm very lucky I have two here that came out of a herd that wean naturally, and they are completely different beasts. You know, it's amazing the difference it makes. So yeah, it's but definitely I have seen, you know, even like I had one that weaned naturally and she had a tooth fracture, so a dorsal slab fracture. And over the few months after that, she developed really bad separation issues that she'd never had before, but she still lived with her mum. Now, she was quite happy to leave her mum, but when that happened, all she wanted to do was be with her mum that whole summer. And she was 12 when that happened. So, you know, it's amazing how pain, and I've seen it with a lot of client sources as well. It's amazing the impact that pain has. I suppose we all want our mums when we're not feeling great, but if we can't have our mums, we want the next best thing, you know. Anyway.
Yeah, but very interesting because she's not good in the field out in the field with others. She's yeah. So I would say probably, as you say, no exposure to bird and all of that. But
you can, I mean, it's amazing what you can start to teach them, even when they're older. But it is hard, you know, they're primed to learn it when they're young. And I think the separation stuff you don't ever undo when they've had that abrupt early weaning. I mean, they've shown with studies on other species and in humans that it's basically orphaning. You know, they don't know that their caregiver hasn't died. You know, they may as well have died from their perspective. And you get permanent brain change. You know, you get a predisposition to anxiety, depression, all kinds of issues. And that is a huge proportion of our horse population. Honestly, if there was one thing I could change, like wave a magic wand and change, that would be it. I think it would make, if we could change the time of the sales, change the habit of people selling to, you know, change it to a year, honestly, the difference it would make would be unreal. Not that that's got anything to do with kissing spines, but it doesn't help. Anyway, does anyone else have anything they want to ask? Lisa and I are just having a great time chatting here.
oh, everybody's very quiet.
Yeah, it's very quiet tonight. There's not even a question in the chat, listener. Is there chat?
If anybody wants to write something instead, you're very welcome.
If you want to talk, it's fine. I don't mind. Or post something on the group afterwards, you know.
No, I'm going to look forward to the because you were saying the pain faces on that course. So yeah, I'm going to study that. I've got a foal who's got permanently wrinkled eyelids, and I'm now going, oh my God, I'm going to have to, I think she was born with them though.
Yeah, I mean, you get a degree of kind of of expression, you know, that is confirmation based, but it's looking at the whole picture, I guess. You know, and how, and like I remember years ago there was a CPD, I can't even speak, CPD day for physiotherapists that I went along to. And as soon as the girl running it heard that I was a behaviourist, she said, "Oh, great." She said, "You can tell us what you think of every horse when they come out." And so they would come out and I would look at them and I would say, okay, because you can see, you know, whenever the wrinkles are really like deep in their face, you know, that's a horse that's had chronic stress of some kind. And more often than not, it is pain, because even when they relax, the wrinkles are still there. So I was like, well, I think that horse has had a long-term issue. And then there would be another one that didn't have wrinkles, but was wrinkling. You know, and each time, I remember there was one in particular that to me looked quite sore in her face. And they started working at her. And, you know, there's a team of physios all kind of palpating and they're like, no, nothing here, nothing here, nothing here. And after about 15 minutes, they hit the point, oh gosh, she's really sore there. Goodness me, that horse must be in a lot of pain. And I was thinking, yeah, I know, like I can't diagnose. I don't know where, I couldn't have told you where the horse was sore. I just knew from the expression that they were. So it's definitely a valuable tool, I think, you know, just.
Yeah, absolutely. Well, I'll definitely get that up on the group once I've got the details for sure.
Brilliant. Anyway.
Oh,
I think
you're muted. Oh,
Linda, I can't hear you, so I don't know if you're still muted or something. No, you're not muted. No.
it's funny, I was talking to Linda earlier, but
Yeah, no, it definitely says you're not muted. You haven't the headphones or anything plugged in? No. No. Don't know. Try unmuting it. No. It's still not working. Do you want to send a message?
oh, it's saying you're muted now on
Yeah,
your
you're muted.
box.
Yeah, she just muted it. Um,
And whenever I go down, and maybe I'm not allowed to unmute people anyway. That's probably what it is.
um,
No.
well, do you want to type in the chat, Linda? Yeah, type a message in the chat. And we'll just wait patiently.
Hmm? Yeah, we can't.
Technology is just one of those things, isn't it? It's like,
And I was talking to Linda earlier, and it was working, and then now it's whatever's happened. I don't know.
Red. What line is it? It's unless Helen has to do this hope.
yeah, well, I don't think though, because whenever I went to her thing, it said she wasn't muted. So I don't think there was anything else I could have done. Oh, here. Oh, here, right. Okay, she's typed a question. Thank you. I help people in rehabilitation and watching the behaviour is major important in rehab training. Absolutely, Linda. Yeah. You know, and I'm not a rehab trainer, but I can see that having been involved with rehab training. Definitely. The more people can be aware of that, the better, I think. But it's the owners as well, because it's all very well giving them exercises to do and then saying, away you go and do those, you know, and do 10 repetitions of this and, you know, 5 minutes of that. But if they can't see what the horse is telling them, then they will overdo it, I think.
Yeah, perfect.
Brilliant.
That's everybody. Thank you so much. There's Nikki's thanking everybody as well. Absolutely, and very interesting stuff. I'll probably be going back out to the stables now and analysing every horse's face for the
I know.
I'll go down another rabbit hole for a while, but
Do you know, it's one of those things, I think also you've got to be careful not to read too much into it. So it's about the context as well. It's always got to be about the context. And, you know, emotions change minute by minute. It's whenever you see something again and again in a particular situation or over a period of time that you kind of go, oh, okay, I need to pay attention to that, you know. But yeah, we're not all happy all the time.
no, well, that's very true.
Sadly. Anyway, thank you very much, Lisa. I really appreciate it.
No, thank you for giving up your time. Absolutely wonderful. Honestly, if anybody has any questions, either message Helen directly or you can put it in the group or whatever, and I'll get the info up about your courses. And if anybody wants to contact you about one-to-ones or whatever,
yeah, that's a problem. And anyone, I mean, obviously I see people locally, but I can do stuff online as well. It's actually surprising how much you can do online, I've discovered, having been very anti it for years.
COVID did actually improve that. Thank you very much.